It's the latest. I'm Faye Rowlands.
New techniques, innovative approaches, expert advice. Talk Health on Talk 100.3.
Right, it's a bright Monday afternoon and you are with me, Ronak Kotecha, on Talk 100.3. This is Talk Health, and tell us, how was your weekend first to begin with? 0586861003. I hope you had a great weekend and you also took care of your health while you were at enjoying the weekend, and not let your guard down and have too many unhealthy things, because weekends are generally cheat days. And today we have someone really special on the show. We haven't had an endocrinologist or for a long time on the show. We have it today, Dr. Sara, the endocrinologist from Canadian Special Hospital, Dubai, is with us, and we're having her because we had World Thyroid Day on 25th of May. So, Doctor, welcome to the show. How are you this afternoon?
Yeah, hi. Thank you for having me here. Hi, I am Dr. Sara Alam. I am working at Canadian Specialist Hospital, Dubai, and I'm having a really nice day, and it's great to be on the show.
Absolutely, and we're hoping to have a lot of discussion around thyroid, because that's the buzzword these days. A lot of people are suffering from it. People don't even know about it, what it is, and we'll get to all of that. And if you have any questions regarding thyroid, then please hit us up on 0586861003. That's the number. Doctor is going to be with us all the way till 2 o'clock, so we will ask her all these questions. So, Doctor, let's jump in right away. What exactly is thyroid, if you can just tell us in layman terms?
Okay, so the thyroid it's a normal gland, which is a butterfly-shaped endocrine gland located in the front of the neck. So we all have heard people say, I have thyroid.
Yes.
So that is technically weird sounding to us, because everybody has thyroid.
Right.
So they actually might mean that they have a thyroid disorder, like hypothyroidism, hyperthyroidism, or thyroid nodule, which we will subsequently talk about. And I hope that after today's session, everybody knows these medical lingos, right?
And nobody comes to you and says, I have thyroid.
Yeah,
because we all do.
I also have. So we can say, yeah, I have it too, right? If you don't have it, then that's the problem, because it's supposed to be there. If you don't have it, it's also a rare condition which can cause hypothyroidism since birth, if you don't have thyroid gland.
Okay, that is a condition altogether.
Yeah.
All right, but there are a lot of myths around thyroid. We'll come to that. But if you can just tell us the main two forms. One is hypothyroidism and one is hyperthyroidism. So let's jump into the first one, which is more common.
Okay, so the hypothyroidism is the more common one. So if somebody says I have thyroid problem, then it's likely to be hypothyroidism. So just little bit in the medical terminology, there are two main thyroid hormones secreted by the thyroid gland.
Right.
It's, as I already told you, it's located in the neck, and it produces two hormones, T3 and T4.
Okay.
It is controlled by pituitary gland. So we will talk about it maybe next time more in detail. So pituitary gland is actually less famous, but it is the one which is the master of everything. It's like the master endocrine gland, and it is located at the base of the brain. It secretes TSH, and these they have an opposite relation, means T3, T4 exert a negative feedback on TSH. So if T3, T4 are low, that is underactive thyroid or hypothyroidism, the TSH becomes high. What are the symptoms that I will discuss later?
Okay, all right. So generally, which is more common in people?
As I already told, hypothyroidism is more common, and thyroid problem is like something which can affect every organ system of the body. So the symptoms can be very varied from person to person, and you might even not know that it is due to the hypothyroidism problem. Like it can be unexplained weight gain, you might feel very cold, dry skin, hair loss is there, weakness, joint pain, even unexplained constipation. And sometimes some people can just have depression. And later on, it might turn out to be due to hypothyroidism. And concentration problem, and even menstrual problem in females, and hoarse voice, swelling over body. if it happens in children, it can cause short height, short stature, and puberty
okay.
problem,
Okay,
early
okay.
or even delayed. Both can happen in people with hypothyroidism.
Right. But is it true that mostly women go through thyroid issues more?
It is more common in females, that's definitely true, but even men can have hypothyroidism. So the TSH normal range, just like for the most lab, it's like up to 4. So if it is more than 10, we consider it overt hypothyroidism, like more severe. You won't believe, I had a patient whose TSH was 999.
My God, that's a
And-
lot.
yeah,
What's
and-
the minimum you said? 4.
4 is normal. And I was like, how are you even just walking here?
Yeah.
I mean, we have great tolerance in our body. And he said, I feel sleepy all
It was a
day.
he. It was a he.
Yeah, it was a he. That's why I'm telling you.
Okay.
And he said, I feel sleepy all the time. And his wife is telling me he sleeps while talking. And then I say, oh my God, why? Like he said, I did not know.
Why
I
was it
never,
not checked earlier? Yes.
I never checked it. I never went to a doctor. So, it happens. We see some cases. So every doctor has a number which you'll say, okay, this is the highest I have seen. Sometimes some lab don't even report the exact number. They will just say more than 100. So he had, like I say, like it's a Guinness Book of World Record kind of thing.
Right. But 900 you said, I think this must be the highest. It could be like the world
it's
record
like
as well.
the,
I don't think anyone would have encountered.
They don't report it sometimes, but we have seen extremes of cases.
But was this in Dubai?
Yeah, he was.
Oh, it was here in
Yes,
Dubai.
yes,
And
yes.
are you in touch with that patient? Is he doing well now?
Yeah, he is doing very well. He is
Okay.
doing very well.
So you got him onto the line of treatment.
Of course.
Okay. And have you always been practicing in Dubai, or you're from you're actually from India?
I am from India. I did my DM, like it's a 3 years training after doing MD in medicine, specialized training, and then I was practicing in Delhi for some time before moving to UAE.
Oh yes, you said you were at AIMS, right?
Yes, AIMS.
Right. So were you in this were you practicing there? Means you were looking at patients over there as well.
Of course.
And any stories you want to share from there, please feel free to do that. Do that.
So, AIMS is a referral center. So there we have seen all possible kinds of presentations. That's like all varied, and even some patients, they come at when they have extreme symptoms.
Right.
Then only they will present to the doctor, unfortunately.
Okay.
So,
Okay. All right. We've already started getting some questions regarding hypothyroidism and symptoms, and some of it might be repetitive because people are joining in. We might want to recap it when we come back. We will slip into a short break right now, but Dr. Sara Alam, the endocrinologist at Canadian Specialist Hospital in Dubai, is going to be with us all the way till 2 o'clock. And any thyroid issues you have, anyone in your family, in amongst your friends group, then let us know right now. 0586861003. We'll start taking questions from the next link onwards. Stay tuned with us. Dr. Sara Alam is going to be with us.
Talk Health on Talk 100.3.
This is Ronak Kotecha on Talk 100.3. This is Talk Health. We have Dr. Sara Alam with us. She's endocrinologist at Canadian Specialist Hospital in Dubai. She's going to be with us all the way till 2 o'clock. World Thyroid Day was on 25th May. We are getting questions. So before we take that question that has come from Nafisa, I will ask you, what is hyperthyroidism?
Okay, so hyperthyroidism is, you can understand as overactive thyroid. So thyroid is thyroid hormone is related to metabolism. So hypothyroidism makes you gain the weight, makes you slow. This opposite happens. So in this condition, there is excessive production of thyroid hormone. So there is rapid unexplained weight loss and tremors, palpitations, anxiety, and feeling of very hot heat intolerance, insomnia, difficult to sleep. Like the other one, you feel sleepy all the time, and here you are having insomnia.
So both the hypo and hyperthyroidism जो symptoms हैं, they are completely opposite, you are saying.
Right. They are opposite. However, there can be overlap. Like fatigue can occur in both. Menstrual irregularities can occur in both.
Right.
And if you have seen sometimes, like goiter is a
Yes.
bulge which we see, enlarged thyroid gland. It can occur in both hypo and hyperthyroidism.
Right.
And sometimes you may have seen some people, they are having a staring look, like big bulging
eyes, yeah.
That is commonly related to hyperthyroidism. And so exactly we need to do the blood test to find out what are the levels to exactly characterize the type
Right.
of thyroid dysfunction a patient is having.
Right. Nafisa has sent in a question. She's asking how serious are these problems, and we can also add this question that is it ever fatal?
Yes, they can be fatal. They can land you in ICU. And the person I quoted, see, it's very different how each body reacts to something. You know, like for example, pain. Some person may able to tolerate excessive, and some may have
Right.
Excessive response. So even with very lesser values of TSH, like I told you, a TSH in previously very very high, even lesser values, it can land you in emergency. There are two major extreme condition of hypo and hyperthyroidism. That is mixed edema coma. That is a extreme of hypothyroidism, when a patient becomes unconscious and his body temperature becomes very low. It's like the extreme form of hypothyroidism. Similarly, the
Okay.
extreme form of hyperthyroidism, which is emergency, is called thyroid storm. Suddenly there is very excessive heartbeat, sweating, palpitation, and that can also land you in emergency.
But is it rare?
These are definitely rare, and but untreated, if you're not treating it, if you are not paying attention to it, there is a point till which body can compensate. After
Right.
that, it goes into
Okay.
like this emergency situation.
All right. We'll stop for a short break. When we come back, we'll ask Dr. Sara Alam, of course, the questions that are coming in from the listeners, but also, what are the tests that one can do? And there are a lot of other questions as well. Very important ones. World Thyroid Day was just there on 25th May, and I don't think there is enough awareness about this. So this really needs to be spoken about. Stay tuned. Dr. Sara Alam is going to be with us all the way till 2 o'clock.
Talk Music, brought to you by insurancemarket.ae. Talk Health on Talk 100.3.
At 1:25 p.m. on the clock, we have Dr. Sara Alam, endocrinologist at Canadian Specialist Hospital in Dubai with us. It was World Thyroid Day on 25th of May, and which is why we've got doctor over here to answer all our questions about thyroid. So if you have any, then you can message us on 0586861003. You can even call us on 8008-1003. That's our toll-free number. But let's continue our questions that I have, and the ones that have come from the listeners as well. Doctor, some questions might be repetitive, but you can give a recap because people keep joining in at certain points in the hour. So the next question that I had for you before we went into the break, I asked you what kind of tests should one do to get to know about thyroid.
Okay, so if you want to do a single test, which is the most sensitive, you can just do TSH. Okay, the normal range for TSH is it may vary from labs, but most commonly accepted difference range is between 0.4 to 4. So
Okay.
it shouldn't be in that range.
Right.
High is also not good, and low is also not
Both
good.
in men and women?
Yeah, it's same for both in men and women. Also, if we want to do a full profile, that is, it can include T3 and T4 and TSH together. Then there are some antibody tests, which is TPO antibody and thyroglobulin antibody. So these antibodies tell about the etiology of thyroid dysfunction. Like it's like a marker of disease, whether you have what kind of hypothyroidism, how will it be permanent or not, so that we can have some idea with
Right.
the antibody test.
But the earlier ones that you said are all blood tests?
Everything is
All
the
of them are
tests
blood
blood
tests.
test. Yes.
Okay, so you can do it along with your lipid profiles and your
Of course.
sugar and all
If
of
one test you want to do, you can do the TSH.
that. TSH, all right,
Yes.
okay. All right. So the next question that I have for you is, does thyroid dysfunction always require treatment?
Okay, that's a very good question, and that's often asked to us. So that depends upon the severity. So we may have heard people say, okay, I took this natural treatment and I got cured of my thyroid dysfunction.
Okay.
So not to belittle any treatment, but in general, actually, what is somebody may be having a problem that you might not be having. The thing is that some thyroid dysfunction is recovered automatically, like body recovers, self recovery is there, so it does not always require treatment. Okay. So that depends upon what are the labs, how severe it is, and what are the antibody levels, and also
what are the symptoms also, right?
Of course, and also like in pregnancy, if somebody is having pregnancy, then it's very important to keep this thyroid levels, the hormone levels, everything in the normal range, because it can adversely affect the baby. It can even cause miscarriage if left untreated. So in a non-pregnant person who is not having any symptoms, we may leave untreated. Say somebody is having a TSH of 5 without any symptoms. Okay, we may say, okay, you don't take any treatment. But if a similar report is for a pregnant female, then we will of course tell her to take treatment. So that depends upon the associated conditions or the symptoms as well.
Because hormone limits differ during pregnancy, right? Are they higher or are they lower?
Actually, normally the TSH becomes lower in pregnancy. So even suppose if somebody is having 4.5 during pregnancy, so it's high for that, because normally it becomes low in pregnancy.
Okay. But you think that during pregnancy, majorly in women, thyroid problems do occur?
Yeah, it's very common.
Very common.
And it's very important, especially if somebody is pre-existing having a thyroid problem, then dose needs to be increased, because there's an increased demand. In the initial 3 months of pregnancy, the baby is entirely dependent upon the mother for thyroid hormone. So if you yourself don't have enough, how
are you going to give it to the baby? Yes,
of course. So that's gonna be a problem. In fact, many miscarriages also occur if it's not properly treated during pregnancy.
Okay, so I'll just share a little bit of personal experience with thyroid with you, is because I didn't know about it so much until my mom told me that she has it. And what she even said was that mostly it happens in women after a certain age, and that's kind of one of the, I don't know if it's a myth or if it's true, but most women say this all the time, especially our mom's age. So is that really true? And they don't know about it. Actually, she doesn't have too many symptoms, but that has been, and she's always taking some medication for it.
Okay, so it's true that it's more common in women, but many times it's very commonly remains undiagnosed. They don't test for it. So it's very common in reproductive age women. It's not like it will just present in older age or something like that. So it's now actually I think people are getting more aware about it to some extent. Otherwise, previously they didn't even test for it, and didn't even know about it. Now people are sort of having awareness about it,
which is why it's important to talk about it, right?
Yes,
because there is a condition which you're not aware about, and then there's misdiagnosis as well, and there's, you are trying to take different kinds of medicines to cure something completely different. Why do you think there's less awareness about thyroid to begin with?
Actually, the symptoms are not very specific, and you don't know that these symptoms are happening because of the thyroid problem. Like somebody having short stature, not growing, and severe short stature, and you give treatment. It's so gratifying. There's such a good response, and it sort of works like magic to some extent.
Right.
So the treatment is very gratifying, but we don't know. People, they don't know it's
right.
happening.
That's because of thyroid. But any
hypo-
success story or any such stories you've had here in Dubai in your career so far?
Actually, I had a patient. He was having cardiac arrhythmia. It's atrial fibrillation, and he was being treated from India, and he was taking some medicines. Incidentally, for a routine checkup, he got his test done, and he was found to have hyperthyroidism. So many times it's not, and his condition would not improve, and he had such a severe form of hyperthyroidism. And when I gave him medicine, he became so much better. He felt it felt great to help such patients.
But is it really curable, or do you have to keep treating it like with medicines all the time for as long as you live?
Actually, that depends. I told you it depends upon the etiology. So with the hypothyroidism, the most common is Hashimoto's thyroiditis. That's the technical term for it. In that, mostly, if severe form is there, lifelong treatment is required. So that also we are commonly asked that now my TSH is normal, can I stop the medicine?
Yeah.
So sort of to understand, like you are wearing glasses and you are seeing well. So if you remove it, then
if you remove the glasses,
you won't be able
you
to
won't
see
be able to see
it.
clearly. Yes.
So sort of like that, but it's not same for every disease. So like with hyperthyroidism, it can be cured. Hyperthyroidism. So we give treatment for 1.5 years, and then many patients, they get cured. And there are other treatment options also. If the size of the goiter, like I talked about goiter is like enlargement of thyroid gland. Sometimes
in the neck, it becomes much a bulge on the neck.
So if it is very big and it's causing hyperthyroidism, then we can get it removed by surgery. So that sort of cures that problem. However, it will then become into hypo, that you have to take the medicines for hypo. But hyperthyroidism is a much more difficult disease to manage, with more ups and lows as compared to hypothyroidism.
Oh, is it like that?
Yes.
But you said that hyperthyroidism, when it's hyper, it can be cured at some point.
Yes.
But you think hypo can never be cured? Is that what you're saying?
Hypo, if it's in like more severe form, then in majority of cases it requires lifelong treatment.
Okay.
If it is overt, like some cases we have seen milder forms which may spontaneously function recovers, but in majority of cases it requires lifelong treatment.
Right.
That's how it.
But
works.
on an average, I think a lot of people must be living, because since it's a gland in all of us, there might be fluctuations in that hormone, and a lot of people might be living with it. So statistically, would you say that 1 in every 3 people or 4 people, is that so common? Is it so common, the
This
dysfunction?
hypothyroidism is really very common, and there are various reasons for these fluctuations you are talking about. So a lot of people, they ask about what is the diet. One of the
we have a few questions regarding that, but since you said we'll take it in the last link.
So there are many precautions which need to be followed while taking the thyroid medication. So even if you are taking the same medicine for the thyroid, but you might have fluctuation. The reasons being, you have to keep a proper gap with food, otherwise it will not get absorbed. So suppose if you are drinking your tea or coffee immediately after taking thyroid medicine, it will not get absorbed.
Oh, okay.
So ideally there should be a 1 hour gap, but at least 30 to 45 minutes gap is mandatory. Another thing is that if you are taking too many that antacids, like everybody pops up, like I'm having
pills,
acidity, or any supplements like iron supplements or calcium supplements. If you are taking those supplements, then also you need to have a 4 hour gap with the thyroid medicine. So ideally better to take thyroid medicine, it should be taken empty stomach in the morning, and the supplements you can take with lunch or dinner.
Right.
Do not mix it with the so the same. And also if you are gaining weight, so the dose is weight based. If for some reason you have gained weight, then you will require a higher dose of the thyroid medication.
Right.
So these are the reasons that, okay, you are having same dose, you are doing the same thing, then still your thyroid levels are fluctuating. The TSH is not coming under control. That can be the reason. And one of the common reason is missed doses.
Missed doses, yeah.
This can be done only with thyroid medication, not with other medication. That's a disclaimer I just want to tell.
Right.
But suppose if you miss one dose of thyroid medication for any day, suppose you went for some holiday and you forgot to take your pill with you, you can take 2 tablets next day.
Oh, you can compensate by
Yes,
that.
it's
Okay.
because it has a very long half-life.
Right.
But it's not for any other
medicine. No, we understand that. But
So
what if you miss like 3-4 days and then
actually,
can you take?
there are some studies which can like some people who live in nursing homes or in old age homes and they have dementia and they need
They'll forget.
supervised. So there are some studies that we can give 7 days pills together in one day. However, it's better to not do it because
Yeah.
there can be some
Side
some
effects.
people not tolerate higher dose altogether. That is one
Right.
issue with that.
But what could be the possible side effects of medication of thyroid?
Thyroid medication is actually very safe.
Very safe.
Very safe medication because it's like a normal hormone which is produced inside the body. However, having said that, because thyroid hormone makes you lose weight, so some people they are taking it without actually having the thyroid problem. Some weight loss supplements.
Oh, really?
Yes.
People do that.
So that should not be done. That should not be done.
That is like, yeah.
But what are the side effects? If you don't have this problem and you take this, it can increase your metabolism and you may lose weight, but it can weaken your bones. It
Right.
can make your heart pump more, like it can cause palpitation.
People do all kinds of self-medication.
Of course. And one more thing is that, like I told you, when we start the medicine, so your body has been sort of a compensated state. So we should start especially in people who are having pre-existing heart disease or in older people, we start with very low dose, irrespective of the TSH value. Because they may not
test it, right?
No, not test. They may not tolerate it because their body is like in a compensated state for
long period.
Long period. So we start with low dose and gradually increase it.
Right.
So suddenly, if you see a TSH of 200, sometimes we see some doctors, they can start with very high dose suddenly. So your body will not be able to tolerate it. But otherwise, it's a very safe medicine. And if you actually required it and your doctor has prescribed it, it's not an issue. I mean, if your levels are coming in the normal range.
All right. Okay.
And you actually require. I mean, if your levels are coming in the normal range.
All right. Okay.
And you actually require it.
Okay. We'll stop for a short break right now. When we come back, Dr. Sara Alam is still going to be with us. That's the last chance for you to ask any thyroid-related questions because she is the endocrinologist at Canadian Specialist Hospital in Dubai. And we will be asking her more questions regarding thyroid. So 0586861003 is the number you need to message us.
This is Talk 100.3.
Right, 1:44 p.m. on the clock. We have Dr. Sara Alam, endocrinologist at Canadian Specialist Hospital in Dubai, and she is with us talking all things thyroid. So, doctor, we've got a lot of gyan from you about thyroid, but there are some questions coming in, and we really need to know what is the thyroid diet because that's where the main problem lies, right?
So we are asked this question very often, any thyroid diet, and there are certain substances which if you Google, you will find that they are called goitrogens. But practically speaking, we don't specifically recommend any thyroid diet. You can eat everything you want.
Okay.
Overall, healthy, balanced, nutritious diet is important for and avoiding processed foods, for losing weight in general. Once we start medication, so and your levels, they come under control, they are normalized, then you have to do exercise for weight loss, but there is no specific thyroid diet as such recommended which would greatly benefit you.
Okay.
So overall, like a balanced diet.
That is what is
That
required.
is what.
But is there any food that kind of causes...
That's not true because most of the people, the commonest cause of etiology is autoimmune. So that is not food related. However, we want to link everything to food. We want it to be with food.
We always want to find that one
yes,
culprit.
of course. Actually, we want that, okay, if we do this, to sab theek ho jayega. But that's not, I mean, unnecessary restrictions. Why, if it's not required, then
No, great doctor.
yeah.
Like, we need more doctors like these who say that you can eat whatever you want, because that's what we want to hear from the doctor. And also, since we spoke about exercise, Sudha has asked, what are the best exercises for hypothyroidism? You can say for both hyper and hypo.
Okay, so if you open Instagram or Google, you will find some massages for thyroid. That's actually not gonna help you. But in general, like aerobic exercise, strength training, and whatever is for a normal person,
Okay.
the same works for the person who has hypothyroidism. Hyperthyroidism is like one thing you have to be careful, because they have excessive metabolism. They are having, so if they go out too much in heat, they may get dehydrated, and they have to be more careful because they are already having palpitations. But that is when they are not on treatment. Once they take treatment, their symptoms will definitely improve. But whatever exercise you start, you have to be careful that your body is able to tolerate it and not overdo it like all at once, because excess of anything can also be bad. So you start with gradually and increasing it slowly. That's how it should work. And only one thing, if I would say about exercise, is that you have to do it daily, like persistence and perseverance. That is
Whichever exercise you kind of are comfortable with. How about swimming and walking?
Everything, anything. What is your preference? You can do swimming, walking, jogging.
Jogging, yeah.
Even gym, you can do strength training. That's also gonna help you. But start gradually and be regular with it. It's not like you do one day, 2 hours, and then you are gone for the week. So that's not gonna help you.
Okay, so a lot of things that I'm understanding about thyroid after this discussion is that it doesn't really impact your lifestyle choices or your daily life so much, as long as you are just aware of it, like that you know that your TSH levels are at this point, then you can easily manage. It's very manageable sort of a condition.
Especially hypothyroidism, if you are taking proper treatment, you are following doctor's advice, it's easily managed. But it's like, I would say, it's
for hyper, right?
Hypo.
For hypo,
it's like a more easily managed as compared to hyper.
Correct.
So that is the one which is more common, like hypothyroidism.
Hypo is more common. Okay.
But if you don't take medicine properly, it can cause havoc. It's like it's something which can be easily managed if you are not doing many experimentation of your own. Like many people we have seen, like something which actually make us weep. People, it happens a lot of time that some people, they don't declare this while having arranged marriages, this thing that they have this problem. Okay. Although it should never be the case. I mean, it's something, it's a very, of course, it's easy to manage.
It's a manageable disease,
very easily manageable. So we have seen girls, they don't tell their prospective
to be partners,
families, and they come with pregnancy with TSH more than 100, and we have seen so many miscarriages
because of that.
That's fatal. I mean, that's so heartbreaking. Like something which can be 100% prevented, and I mean,
yeah, that's heartbreaking. Yeah, like, I mean, if they just declare it can be managed. It's not like you're going to lose the relationship, or you're going to lose the person just because you have a certain condition.
If you are going to lose, then it's better to lose
it's
such
better
a
to
person.
lose such a person who's not able to cope with your condition.
Really, I mean, it's better to tell, and then of course.
Absolutely, yeah. It's easier said than done, I understand. But such kind of disclosures are very important. Similarly with thalassemia, because in the last week we did couple of sessions on that, and it was World Thalassemia Day. I myself am a minor, and people don't, it comes as the last priority. Like, people don't even think about it when they are, looking into getting married with someone. They don't say it. And then if both are minors, there is such a big chance of your offspring to become like a major, and then you see what kind of life you're bringing into the world, and then what are you putting that child through, and what are you going through after that? So that that's a very valid point that you've made. Okay, doctor, there is one very specific question about rice. So it's from Rohan. He's saying, is it true that people suffering from hypothyroidism should avoid rice?
Okay, so rice is something maybe next time we can have a talk about on diabetes also. Rice is something which has been too much maligned, but it's not related to.
Yeah, rice is made out to be the villain every time.
Of course.
And most people like us love it.
So if you're having a balanced diet, you can have it's not something you need to avoid, especially nothing related to hypothyroidism at least.
For hyper?
Not for also hyper.
Not for hyper
I'm just
as well.
telling, like, some people, they want to go for low carb diet. Then in general they have to avoid carbohydrates if they are going for that. That also is, any diet can work for you. And it's always better to have a balanced, nutritious diet.
All right. So, Rohan, if you are still listening to us, go ahead and have the rice to your heart's content, but at the same time also understand that anything in excess would be a problem, including rice. So, doctor, the last question that I have, because we're almost out of the time here. If someone has thyroid nodules, do they require surgery? And how frequent is surgery in thyroid?
Okay, so thyroid nodules is it's a swelling inside the thyroid gland. There can be single and can be multiple. They can be associated with both hyper and even normal thyroid function.
Right.
So it's like you have to understand the structure and function. So structurally we have something inside our thyroid gland, and function is like whether it's able to work properly or not. So we evaluate with an ultrasound and the features. If we suspect we have lot of scoring system. And we can actually predict that is it cancerous or not. That is the most important.
Oh, that can also happen. So
sure, that is the most important question to address. And that can be confirmed by a biopsy taken from that particular part. Some thyroid nodules, if they are very small in size, if you go on doing ultrasound for the whole population, even very high percentage, they may have the thyroid nodules. Actually,
right.
It remains undetected. So if it is very small in size and does not have any feature of malignancy like cancer, then we can just
leave it untreated.
Leave it as such.
Yeah.
But if it is causing any symptoms, like if it's growing in size, if it is causing difficulty in breathing, it's compressing your trachea, or in general, if it's too big and somebody does not like it, their appearance, they can always go for...
Which is called goiter, right?
Goiter, specifically multinodular goiter, means having many nodules for the medical term.
Yeah.
So if they don't like it, they can get it removed, and there are many options for removal. Even half of it can be removed. Like you can just remove that particular part.
Okay.
Or some cases a whole thyroid.
But that has to be done surgically, right? It's an invasive procedure.
There are some other procedures also which can be done to the nodule can be taken care of, but most common is the surgical removal, removing the gland with surgery. But then you might turn into hypo, that you might require.
But you can always take medication for that, right?
Yeah.
I think goiter is, correct me if I'm wrong, is it more common in women?
It's because in general the thyroid diseases are more common in women, so
even goiter is also but
more
that way it is
women.
rare. I know it is rare. There were some reports that actress Sadhna, who is no longer alive, did have goiter. She did suffer from that, and even Parveen Babi, if I'm not goiter, she did suffer from that, and even Parveen Babi, if I'm not wrong, they had this condition. And when celebrities, I always say this on the show, when celebrities have a condition, and in India it's not the trend, people in general in celebrities will not talk about any condition. Nowadays, of course,
they are changing,
like from Sushmita Sen to like all the women, like Samantha Prabhu, so many, Deepika Padukone, they talk about mental health also. It's very important they talk about it, because while it may be that one person, but imagine the amount of awareness that they can cause, and they can spread. So it's very important for celebrities to talk about conditions that they have, which can be easily...
So one thing I want to tell you here, like previously iodine deficiency was very common. So at that time the goiter had like a higher prevalence. That can also cause goiter. after like with the iodized
Awareness,
salt,
yes.
and then this condition actually
I remember this.
decreased.
When we were young,
So-
they used to say that have iodized salt, and then all the companies like Tata Salt and all, they started having these advertisements with iodized namak and all that. So I guess that kind of awareness is very required. But thank you so much, doctor. We are completely out of time. Is there any last words that you want to if anything we have missed?
I just want to tell you that if you have any thyroid related issue, then it's very important to reach the right doctor
specialist,
and and to get it checked. It's not like we start with the treatment and you are coming after 2 years with taking the same dose or stopping the medication on your own. So
Right.
that's very important. You can have a talk with the doctor about the plan, like how frequent should be my
Right.
follow-ups, and
Is there a
what
way
should
they
it-
can connect with you? Since we are out of time, I just want to ask you.
uh,
At the Canadian Specialist Hospital, is there a website?
there's a website, and
And they get
they
bookings
can,
online, right?
Yes, they can book through the Canadian Specialist Hospital website.
All right. So Dr. Sara Alam, today she was completely free of charge. She was giving all the consultation. But if you want to talk to her, you can always book an appointment at Canadian Specialist Hospital in Dubai. She's the endocrinologist there. Thank you so much, doctor, for giving us your valuable time. Thank you all the listeners who have sent in your questions as well. I will meet you tomorrow once again right here on Talk 100.3. This is Ronak Kotecha signing off.
Thank you so much.
Thanks.
Talk 100.3.